Heparin is in the therapeutic class of anticoagulant and pharmacologic class of antithrombotic. The therapeutic effect is to prevent blood clots from forming. However, heparin does not break up an existing clot. Heparin is used for the prophylactic treatment of venous thromboembolism or to prevent a deep vein thrombosis and to prevent clotting in arterial and cardiac surgeries. If a deep vein thrombosis were to occur and part of the clot breaks off, it could cause a clot in the lungs or a pulmonary embolism, which if left untreated can lead to death. Side effects of heparin include alopecia or loss of hair, bruising across the body, high fevers, HIT or heparin-induced thrombocytopenia, which means a decrease in platelets, and excessive bleeding. There are two different routes to deliver heparin. The first being subcutaneous, which is in the fat deposits. This can be given in the abdomen, thighs, or fatty parts of the arms and legs. The other route is through an IV infusion. First, an IV would need to be inserted, most commonly in the forearm, which is shown in the video. Following successful insertion, the IV would need to be secured and connected to the heparin infusion using the Alaris pump. The dosage of heparin depends on the weight of the patient. For a 150-pound patient, the intermittent injection is 5,000 to 10,000 units every 4 to 6 hours with a 10,000 unit initial dose. For a continuous infusion, it is 20,000 to 40,000 units per 24 hours with a 5,000 unit initial dose. Foods high in vitamin K should be avoided while taking this medication because it can decrease the ability to prevent blood clotting. Foods to be avoided include broccoli, cabbage, spinach, and avocados, as well as collard greens, kale, turnip greens, and Brussels sprouts. While receiving heparin, you should be sure to not take any sort of NSAID, as this will increase the chances of bleeding. Drugs like Joxin, tetracyclines, nicotine, and antihistamines should also be avoided. If toxic effects of heparin were to occur, the antidote protamine sulfate should be administered. Heparin could be a potentially dangerous drug and should only be used in the hospital setting under supervision. Be sure to talk to your doctor to determine if heparin therapy is right for you. Be sure to notify the nurse or healthcare provider of any abnormalities such as the side effects listed and talked about, as these could become serious and life-threatening. Thanks for watching.